What's up, everybody? And class. Hey, guys. So, we got the foot today. No free feet. No. Y'all behave. Don't be making weird comments, please. Don't need none of that. So, we're doing the foot today. Obviously, if we were doing, it's the other thing you have to remember when you're doing foot x-rays, don't scratch your face, use your arm or something. Is there anything about her foot right now that we would need to change before we did an x-ray? One of the new people. The jewelry. Yes, we would get rid of this because that's going to come out and it's going to get in the way of the x-ray. So we would not want that on. Can a patient refuse to take off the jewelry? Yes. Are we going to encourage it to stay on? No. We're going to try to convince him to take it off. But at the end of the day, the patient's in charge. We cannot tear it off. So take that as it is. So we have a left foot. Where do we want to be centered for a foot x-ray? Don't everybody shout it at once.
The third MT.
The who, what, where?
The third MT.
The third MT. What's MT? Metro Transit. Metatarsal.
Well, the base of it.
The base of the third metatarsal. And what is our angle? 10 degrees which way? Cephalic or posteriorly. Okay, I started saying this feels like it's loose. I'll show you a little bit how this moves. So, third metatarsal runs about to right here, and you can feel them. You can feel the metatarsals, and then you can feel the bones change. You can feel the tarsal bones through here. So let's get your foot straight. Marker on the lateral side. If you were using a shield, you would shield the patient. Again, lots of arguments about shielding now. I had somebody on my TikTok recently asked me a silly question. He simply said, where does the radiation come from? I thought maybe he didn't understand anything. I said, the radiation comes from the x-ray tube. He's like, wrong. The x-ray comes from the x-rays trapped inside the lead, bouncing around, affecting the patient. I'm like, well, you didn't ask. You just said, where does the radiation come from? So it was somebody else who's saying that the lead causes more damage than it helps, which is the concern right now. As an instructor, I have to teach y'all how to use the lead, where it should be applied. When you get out in the field, you make those decisions yourself. So we would shield the patient's reproductive anatomy, even though it's not within 10 centimeters of the beam. Okay, so we should still do it. Again, at the end of the day, it's up to the patient. The patient can refuse. The patient can say, no, I don't want it. Fine, we're done. All right, so 10-degree angle to the third metatarsal, the entire foot in the image, no rotation, nothing like that. Okay, so that's your AP axial. What would be next? A what? Oblique. A medial or a lateral oblique? Which is going to show the metatarsals better? Medial, exactly. How much do we want to rotate the patient medially?
30 to 40.
30 to 40 degrees. Okay. How come not all the way to 45?
They start overlapping.
Okay, so they start becoming superimposed. Yeah, we're going to superimpose the metatarsals too much, so we don't want too much rotation. So we're going to take the patient's foot, and we're going to rotate it about 30 to 40. And I know you new guys are like, how do you know that's 30? How do you know that's 40? Practice. Practice is the way you know. You do it enough, you can kind of see it. So I try to picture what 45 would look like, go a little bit less. 90 we know would be a true lateral. Half of that, a little bit less. So just start playing around with it to start getting a feel for those angles and such. And I'll help y'all with that when you're practicing. So this is going to be your medial oblique, 30 to 40 degrees rotated medially. Marker on the lateral side. Still centered pretty much at the third. I'm going to move you just a little simmer. right there would be your medial oblique of the foot. Questions? Okay, what type of lateral do we do? Medial lateral or lateral medial?
Lateral medial.
Lateral medial, so we want like this.
I mean medial lateral.
Medial lateral. There we go. So let's bring your leg out a little bit. Golly, this got twisted up like a pretzel. That looks so uncomfortable to me. Technically, on the lateral, there's a certain thing we want done to the foot. Does anybody know what we want done to the foot?
Dorsiflex.
Dorsiflex. Good job. Is that dorsiflexed? No. So we're probably going to need to rotate this. So we want to dorsiflex it 90 degrees. So if we do that, we want it lined up with the image receptor as well. We want it along the long axis of the IR. And we want the marker on the anterior aspect of the foot. This is anterior up here. So for this one, I'm going to rotate my collimator a little bit so I can also have it lined up with the direction of the image receptor. So see, all I did, this has a little knob right here. Loosen that and it'll allow you to turn this. Heads up, this, especially the black part back here, gets very hot. So don't burn yourselves, new guys, okay? We all know this. And sometimes we do this to warm our hands because it gets so cold in here. But it does get very hot, so be careful with it. So now that I have this angle matching the angle of the image receptor, when I look at my image on the screen, it's going to be straight. If I did it like this, it would be crooked. So this makes the image appear straight on the screen. That would be your medial lateral of the left foot. Okay? Any questions? No? All right, so that is the 3 views of the foot. Thanks for watching. See y'all later.